WHO Director General Tedros Ghebreyesus has called on UN member states to fully support its COVID-19 vaccination plan, noting that lower-income countries are far behind target. Ghebreyesus says the WHO has set a goal to vaccinate 10% of the population of every country by the end of September, 40% by the end of this year, and 70% by mid-next year. Almost 90% of wealthier countries have now reached the 10% September vaccination target, but 50 countries, most of them from Africa, won't achieve this month's goal. Ghebreyesus also called on high-income countries to step up their pledges of more than 1 billion doses to the global vaccine distribution facility COVAX. He says less than 15% of those doses have materialized. Well, to get more insights on this, we're now joined by Dr. Aslam Dasoo, a co-convener of the Progressive Health Forum via Zoom from Johannesburg, South Africa. Doctor, the US has pledged to donate a substantial amount of COVID vaccines to poorer regions of the world. Is this gesture coming too late, and could the US have had a better response early in the pandemic?
Good afternoon. Thank you for inviting me. I think this is a question of geopolitics. For those of us who have been in the struggle for more equitable access to medicine over the past couple of decades, and which was really emphasized during the AIDS crisis, can observe a step change in the situation that the pandemic has produced. Whereas before, it was really a question of countries which required medicine and which were afflicted with disease, which was not afflicting rich countries. The pandemic has changed the game. And I think this is reflected in how global leaders are now responding, because they understand, or are beginning to understand, that this is a global struggle. This is something that has to be done on a global scale. They can't just do it for themselves. And I think President Biden is showing good leadership in this regard. Certainly the United States pledging now over 1 billion doses is very helpful. And on another matter, the targets set by the WHO were always an aspiration. We understood, and this is important, that these are necessary targets, but that it would be unlikely that all countries would be able to achieve these targets given the current situation in terms of equality and global trade and the power relations in the world. So I think on both those scores, we are beginning to see some movement, which is encouraging, but I don't think we can be too optimistic about reaching these targets at this time.
And Doctor, countries like China have been very considerate of the existing COVID vaccine inequalities. Is it practical then for the US to seek to help vaccinate 70% of the world's population?
Of course it is. I think, if we can vaccinate 70% of the world's population by mid-2022, it's a highly ambitious target. I think that will certainly make a big dent in the pandemic. And China has been at the forefront of pushing countries to step up to ensure that this happens on a far more equitable global scale than before. I think the fact that the West, the richer countries of the West, are beginning to make the right noises is really telling. As I mentioned, I think it's because they understand it's in their self-interest now to reduce the inequalities around vaccine access. And so this target of 70%, as I said, it's highly ambitious, and it certainly will not be uniformly achieved, I think, by the time it's expected, but there will be significant progress by that time to vaccinate the global population. Here's the problem, though. You can get vaccines to many countries, and over time and through various efforts, as we see now. The problem would be administering those vaccines on a large scale. Many countries do not have the capability of doing that, not now at any rate. They'll have to step that up. But that is now a focus for those governments. that it's not just about getting boxes and batches of vaccine delivered, it's about the systems that must flow from that point to getting those jabs into people's arms. And I think there is going to be the biggest challenge of all. I think the vaccine supply issue everyone knows about. Everyone can see where the gaps are and the difficulties and the inequalities. What we are not having a clear view of is the delivery capability of many countries. And this is perhaps where the UN and the WHO need to shift their focus if, of course, we can still maintain the supply of vaccines, which of course is the primary concern.
Finally, briefly, Dr. Dasoo, the World Health Organization has consistently been calling for a more equitable distribution of COVID vaccines. Are countries like the US then justified in considering booster shots for their citizens?
Yes, this is a fraught question. And listening to the US administration, President Biden has said that yes, it's both feasible to do that for their own population, as well as supply vaccines to the rest of the world, and it's not an either or. Well, I think that too is a little, questionable. I think it is a bit of an either or, and the science on the third dose boost of certainly the two-shot vaccines like Pfizer, only really justifies vaccinating people with a third boost who have, underlying immune compromised positions. Well, we can certainly say in South Africa and many countries in Africa that we have high numbers of immune compromised people who would naturally fall into that category, but we haven't even given them a first shot. So the issue about a third dose, while I can understand a country wanting to protect its more vulnerable citizens, cannot be a mass rollout. The first most important thing, and the WHO is correct here, is that we need to get the first jab into the arms of most people that we can in the shortest possible time. And that must be the overriding strategy. I think the fact that there's some movement now among the richer countries to donate vaccine and to open up supply is very encouraging, and that must be pushed hard. But these ideas that you need to give third, and some countries are even doing fourth booster shots, are not really fully supported yet by the science, even though they do show some increase in immune response. But at a mass scale and in terms of managing the pandemic, it's not really viable. And at this point, we need the vaccines to go to those regions of the world where there has been a shortage of supply and a very low rate of vaccination.
All right, Dr. Dasoo, thank you very much for speaking to us on Africa Live. Dr. Aslam Dasoo, Co Convener at the Progressive Health Forum, speaking to us live from Johannesburg.